1st of December 2019, the World Health Organization was informed of several cases of viral pneumonia of unknown cause detected in Wuhan City, China. Since the outbreak, cases of 2019 nCoV have been reported elsewhere in China and in 24 other countries worldwide. Now, there's been a marked increase in not just misinformation about the illness, but also a sharp rise in xenophobia towards members of the Asian community. Tonight, we'll look at these issues more closely with our guests. Joining us first is Dr. Alisha Sahu Khan, the Head of Health Protection. Good evening, and thank you for making time for us on this show tonight. So just getting straight into it, what is a novel coronavirus?
Okay, so first of all, what is a coronavirus? Coronavirus is a group of viruses that are known to infect humans. Of them, just about 7 we know now infect humans. Otherwise, they're found in nature, in animals. The 7 that we know, most of them cause mild disease, typically mild disease in humans. So these are upper respiratory tract infections, so your cold and cough and cold. We do know that certain coronaviruses are more predisposed to cause severe disease in humans. The first one known to do that was severe acute respiratory syndrome, SARS, which caused an outbreak in 2003. Then after that was Middle East respiratory syndrome, MERS, which came out in 2012. So coronaviruses are actually very common amongst humans. They're just one of a number of viruses that cause respiratory infections and usually mild infections like colds and flus.
So how is the 2019 nCoV different from this? Or why does it stand out?
Well, for one thing, it was not known until just recently. So as you mentioned, it caused this outbreak of pneumonia of unknown cause in Wuhan, China, and then quite quickly, so the outbreak started in December, and quite quickly by, I think it was January 9th, the Chinese health authorities sequenced it and found that it was actually a new virus, but in the coronavirus family.
Mm-hmm. So to get to the root of it, of course, we cannot determine exactly what it started from, but how is it spread?
Okay. So yes, as you mentioned, it's believed that it jumped from an animal to a human, probably in one of those live animal markets in Wuhan. It's spread similar to other coronaviruses through close contact, so through respiratory droplets. So if somebody sneezes, coughs directly on you, on your face, or if someone sneezes and coughs like this into their hands, and then they shake your hand. And they shake your hand, and then there's a natural tendency for people to touch their face. When you touch your face, it's near your mouth and goes into your mouth, and then you become infected with the virus. It's also possible also that if someone has the virus and they're sneezing or coughing, and then they contaminate their hands and they touch a surface like this, and someone else touches that surface, it's a possibility that that person will also get it because they'll touch their face after that. So it's not as infectious as other diseases like measles, which is our most infectious disease. Measles, we know, is airborne. If someone with measles coughs, it can stay in the air for about 2 hours in a closed environment like this. So it's not that infectious, but it is quite infectious in terms of close contacts of a case.
We've seen a lot of people mislabel this and incorrectly call it a killer disease, but that's not the case. It's only people of a certain age group, is it people of certain backgrounds? Who is more susceptible to it?
Well, technically that headline, killer disease, there are a lot of diseases that are killers. Your most benign disease, chickenpox, for example, can actually kill someone. A very small percentage of people, but it can kill. That's the same thing with this disease, and I'm not trying to minimize it at all. The WHO has declared a global health emergency because of this disease, but they also announced this morning that just over 80% of the people who have gotten this disease, and this is during an analysis of the first 17,000 people who got it, just over 80% of them had mild disease. So they had cough and cold, sneezing symptoms, a disease progression that does not need to be, you don't need to be admitted for that. And we know that the people that are more susceptible to getting the serious form of the disease are those in the older age groups and those with predisposing conditions. So other medical conditions that basically reduce your immunity and the immune system's drive to fight off these diseases. So yes, it is a disease to be concerned about on the global level, but also you need to, I think, read a bit behind the headlines to exactly see what they mean when they use these terms.
Let's move on to looking at prevention and also myth busting, some of the rumors that are going around as to how you can protect yourself. First and foremost, like you said, there is no cure or vaccine to this, correct?
Yes.
All right. Moving on, how can I protect myself? Just to be more vigilant in making sure that I don't catch it and I don't spread it.
So just like any other respiratory disease, this includes influenza. The way you protect yourself from getting these diseases is, first of all, wash your hands. It sounds so simple and so something that's so common, but it's so true. You will protect yourselves and your families from getting these diseases if you just make it a habit to wash your hands with soap and water regularly, or if you don't have soap and water nearby, carry an alcohol-based sanitizer. And also, I think a lot of people are not aware that there's a way to wash your hands. You need to be washing your hands about 40 to 60 seconds for it to be effective. You're covering all of the surfaces of your hands, the back of your hands, everywhere.
If I could just ask you to maybe just raise your hands upwards and just sort of give us a demonstration as to the proper way of using hand sanitizers as well,
Okay.
to minimize the risk of contracting this illness.
So if you're using a hand sanitizer, it should, when you pour it onto your hand, it should cover all of the surfaces. So you're not just putting a little bit in the palm of your hand, it should cover all of the surfaces. It's the same thing when you're washing your hands with soap and water. You cover all of the surfaces of your hand with the soap. You rub together like this, in between, then over to this side. So you're covering both sides of your hand. Make sure you're covering your thumb. Again in the palm of your hand. And then you finish up. This, I'm doing it very quickly. It should take between 40 to 60 seconds to do that, to really get your hands clean. And it's a similar method with the alcohol-based hand sanitizer. Again, you're covering all the surface of your hand and all around. The reason you're doing this is because you're in the daytime, wherever you are, you're touching surfaces all the time, and that's getting contaminated. Other people have touched those surfaces. They may have sneezed or coughed on their hands and touched those surfaces. And then what do you do with your hands? You don't realize how often in a day you're actually touching your face with your hands. And it's when you touch your face, when you touch your mouth, that is when you're spreading the germs from the outside into your own body. So this is the most important thing I could say, is that please wash your hands. Also, if you see anybody that has symptoms of flu-like symptoms, cough, fever, sneezing, stay away from them. Try not to get in contact with anybody with those kind of symptoms. If you have those kind of symptoms, if you're coughing, if you're sneezing, cough into a tissue, throw that tissue away, wash your hands after that. If you don't have a tissue with you, don't cough into your hands. A good practice is to start coughing into the crook of your elbow like this. The reason being, because when you do this, you don't contaminate your hands and you're not going to touch other surfaces and get other people infected.
Thank you. When we come back, we'll look at more preventative methods and also give you more information as to what is correct and what is incorrect concerning NCOV. Welcome back. Dr. Sahil Khan, we're looking at preventative measures when it comes to NCOV, and you mentioned the most important one, which is basic hand washing and making sure that you keep your area sanitized. Let's look at another step. We've seen cases like this across the world where face masks have sold out. We've also seen some different videos, messages, blog posts and everything about which face mask is the right one to use. Could you clarify those details for us?
So the WHO, the World Health Organization, and the Ministry of Health and Medical Services in Fiji does not recommend for the general public just to go about wearing face masks. For one thing, to date we do not have 2019 nCoV in Fiji. Secondly, the evidence shows that there's no evidence that it's effective in preventing a healthy person who's just wandering around in the normal environment from getting any kind of respiratory disease. One of the big reasons for this is that most people don't know how to wear a mask properly. So I have seen a lot of people on social media posting up them, wearing masks, and you look at it as a medical professional and you understand they are not wearing it the right way. So in effect, it's giving people a false sense of security. And by doing that, you're neglecting other methods that if you do those things, like washing your hands frequently with soap and water, you'll neglect those methods that are known to work while thinking, oh, I'm wearing a mask, so I'm protected. So we know that for the general public, it does not increase your level of protection. However, for someone who does have respiratory symptoms, and this might not be for just 2019 nCoV, for other respiratory diseases, it can prevent you from spreading it to other people. So this is what WHO says, is that yes, if you have respiratory symptoms, it might be a good idea to put a mask on to protect other people around you. If you're a healthcare worker, we need to be making sure that our healthcare workers have access to this, because they're at greater risk. They're facing people who are sick every day, who may be coughing. They're taking care of them and coughing in their face, and also they need to have that protection. And if you're looking after someone who has respiratory symptoms and you want to protect yourself from getting the disease from them, yes, in those cases. But the regular use of masks in public, the evidence is that it does not protect you from getting these diseases, often because people don't know how to use masks, and you're not using the other methods such as washing hands appropriately. And also, there's a bit of a worry that people may be using the same mask over and over again. So you cannot use the same disposable mask for days and days, because actually you're increasing your chance of getting diseases. Because firstly, when you're putting the mask on, the particles and viruses, etc., will be on the outside of the mask, right? So that's stopping it from getting to your face. But if you take off that mask, a lot of people don't know how to take off a mask, you contaminate your hands, then you touch your face, and then you can get the virus into your body that way. And if you're using the same mask, of course, it becomes a breeding ground for other things, for bacteria, because it gets warm, your saliva goes onto it, and it's really not something you want near your face. So we are not recommending that the general public wear masks. The other big problem, and the WHO the Director General of the WHO just mentioned it this morning during their press conference, that if everybody starts buying masks, which is what seems to be happening, the demand for masks around the world has gone up apparently 100-fold, we will not have enough for the people who actually need it. So frontline healthcare workers, those who are actually sick. And you may think, oh no, I don't care about that because I want to protect myself. But if we have an outbreak of this disease, say it's in another country right now, it's in China, it's spread to about 24 other countries. Our aim is to control the outbreak in those countries, supply them with as much resources as they need to control it right there where it is. And if they're not able to get all of these protective equipment for their health staff, it will spread because it's being used by people who do not need to be using it.
And while we're on that subject of making sure that we are not contaminating things, is there any reason for people not to share utensils, shared spaces, maybe even to come into close contact with someone? Or is it just a respiratory illness, which means only through whatever comes out from the respiratory tract?
Yeah, so as I mentioned, if someone is sick with a respiratory illness, if they're sneezing, if they're coughing, then we advise the public, yes, to stay away from that person. That person really should not be going out in public. And this is for every respiratory disease that we have, because they're all infectious, you know, because 2019 nCoV, the symptoms are very similar to a lot of other diseases. So in general, we say to the public, even if this virus was not around in the world, not causing outbreaks around the world, we would say to the public, if you see somebody who has symptoms that are sneezing, coughing, just try to prevent yourself from getting whatever disease they have, whatever virus they have, by not being around that person.
In essence, common sense must prevail, but then there's also been cases, or shall we say, a sharp increase in people advocating for all these miracle cures or miracle preventions. People are saying you need to eat more garlic, you need to use more sesame oil in your cooking, and you also need to take more antibiotics. Now, of course, antibiotics only work with bacteria, not with viruses. Can you also tell the general public whether or not increasing, say, for example, your garlic intake or any other sort of dietary supplement would be a preventative measure?
So misinformation has been identified as a big problem for outbreaks such as this. And it's a big problem that's being identified not just in Fiji, it's globally. And it has, I understand why it happens. It happens because people are afraid. This is a new disease we are not used to. You hear people also saying out there, well, influenza causes so many more deaths. You know, globally, it causes up to 600,000 deaths every year, the seasonal flu, right? But this is a brand new disease. We are not used to it. It's been reported so frequently in the international media that I understand people are worried, people are scared, and they want to do everything that they can to protect themselves and their family. The issue is that this opens up this medium for people who may not have the best intentions to put out information on social media. We have access to so much information these days, information out there that is not accurate. So what I would urge the public to do is just to make sure you identify sources of information that are accurate. So you know the World Health Organization is a good source of information. The Fiji Ministry of Health and Medical Services is a good source. The US Centers for Disease Control and Prevention is a good source of information. Until it starts, that kind of advice starts coming out from those sources, please do not take heed of all of these other things that, honestly, if you hear these, this advice, you know, about garlic and whatnot, it doesn't sound right. You know, to the average person, it doesn't sound right. So please do your research, check the source of your information, and don't believe everything you see on social media or on the internet.
Let's get straight to facts. Looking at medical information, what are some of the symptoms and/or complications that the 2019 nCoV can cause?
Okay, so as I mentioned, the symptoms of 2019 nCoV are very similar to any other respiratory disease, including the flu. In Fiji, we're going into our normal flu season. So symptoms of a cough, sneezing, fever, headache, cough, sneezing, fever, shortness of breath is something that happens in more severe disease. These are symptoms of 2019 nCoV. However, just because you have these symptoms does not mean you have this new disease, because these symptoms are not exclusive to it. You can have the flu, you can have just an upper respiratory tract infection. So what we are telling the public is, if you have recently, in the last 14 days, traveled to mainland China, which is where the vast majority of cases is happening, and that's where a lot of human-to-human transmission is happening. If you've been to mainland China in the last 14 days, and then you have symptoms of fever or cough, sneezing, please call these numbers. Please call the Ministry of Health, and those numbers have been publicized very widely, because this is how we would like to pick up these cases early, because we know that if we pick up cases early, early detection is so important. We will be able to contain the spread of this disease. And again, as the WHO announced this morning, the vast majority of people, over 80% of people, will have mild disease. So they will have a cough and a fever, sneezing, running nose, and it won't go beyond that. What we are very concerned about is the people who already have underlying sicknesses, the people who are older who may get this disease, and what will happen to them. They may get more severe disease. So this is what we're urging the public, that just be aware that if you have traveled to mainland China and you get any of the symptoms of this disease, please call the Ministry of Health and Medical Services. For the rest of the public, if you have symptoms of cough and sneezing, please don't be alarmed. It's most likely to be one of your a cold or influenza. You can go and see your doctor, but please don't be alarmed, because currently we do not have cases of 2019 nCoV in Fiji.
So looking at the virus, can it be transmitted during the incubation period?
Okay, so as you know, it's a brand new virus. There's still things we don't know about it. The incubation period maximum time is thought to be about 14 days, so between 2 to 14 days, right? Because an incubation period, what it means is from when you are exposed to somebody with the disease and you become infected, the time from when you become infected to when you first have symptoms of the disease, that is incubation period. There have been some reports, some cases, they say that they didn't have any symptoms and they did transmit it to other people, but these have not been verified. And a recent study that came out was actually shown to be not correct, because a woman that they quoted in the study as having no symptoms, she traveled from Beijing to Germany and then she passed on the disease to other people at a conference. She actually did have symptoms, mild symptoms at the time, and she passed on this disease. So Right now, there's still a lot of research going into it to see if that happens. But what we're saying right now is, if you see anybody that has those upper respiratory tract infections, sneezing, coughing, just generally, just stay away from that people. We're not saying that people would have 2019 nCoV, but you don't want to get sick with any kind of respiratory infection anyway. So please just avoid anyone that has those symptoms.
Coming up after the break, we'll pick up where we left off with more information on the medical side of the 2019 nCoV. Welcome back. Dr. Sahu Khan, moving on to what happens when one is suspected of having nCoV, is it?
nCoV.
nCoV, there we go. So when that happens, of course, we don't have all of the facilities that are accorded to more developed countries. How do you test for the virus?
Okay. So for us to suspect that someone possibly has 2019 nCoV, first they have to have symptoms, so a fever, cough, any of these symptoms, plus a history of travel to mainland China in the previous 14 days. This may change as we get more and more cases spreading across the world and transmission within those countries. But right now, that's the criteria we use. Once that happens, we ensure that that person is isolated. Like last week, we had isolated some people in the Nandi hospital in an isolation facility so that we can prevent further transmission of this disease. And then we take a sample from the patient. Right now, it's called a nasopharyngeal sample. Essentially, it's a throat swab, and we send that to one of the WHO collaborating centers, which is in Melbourne, Australia, for testing. Again, because this is a brand new virus known to humans, there are very few places around the world that do the testing, firstly for their own countries, and then secondly for the rest of the world. So I think now WHO has identified 15 labs around the world which can be used as reference labs for other countries to send their samples to. So this is where we're sending our samples to in Melbourne, Australia.
Now, our Health Minister, Dr. Wangai Nabete, has assured the public that there is absolutely no cases in Fiji at this point in time. And can you comment on what the Health Ministry is doing? How well equipped is it to possibly deal with any cases that do come through, if it does?
So the actions that we are taking to prevent introduction into Fiji as well as spread within Fiji are in line with what is recommended by the WHO, or the World Health Organization. It is a multi-layered strategy. It's not one action is not going to prevent this disease from spreading in Fiji. It's a multi-layered strategy. One thing is prevention, preventing the public from getting this disease, and that's what I've been mentioning about all of that messaging about, what can you do? Make sure you're washing your hands frequently. Make sure you practice good cough and sneezing hygiene. The other thing is that making sure that the public are very aware about what's going on, making sure that we're very open and we're telling the public as soon as we get someone who we think may be possibly a case, we announce it. We did this during measles, we did this during leptospirosis, during meningococcal C. We were the ones to break it to the public that we have a suspected case or we have a case of this is what you should do. So we're making sure that our communications to the public are very open. And this helps to prevent the spread of disease in the community. On another level of prevention, of course, the Fijian government has announced these border control measures. So any foreign national who has been in mainland China in the last 14 days before travel to Fiji will not be allowed entry into Fiji. So this is something that's been put in place to try and prevent the introduction of this disease to Fiji. But we know that because it's spreading across the world, we have it now in Australia, which is one of our neighbors. It spreads in those countries. It is quite likely that it will come to Fiji. So we need to be prepared. And one of the big things we need to do is make sure we detect the disease as quickly as possible once it comes to Fiji. And this is what's happening. You see that we're reporting to the Fijian people about whenever we have a suspected case. It's because our systems are working. They're picking up suspected cases, and even when they turn out to be negative, the fact that we're picking up people who meet this criteria that we put in about you have a respiratory infection, you traveled to mainland China in the last 14 days, the fact that we're picking up anybody shows that the system is working. And then, of course, making sure that we're able to diagnose our system where we're sending our samples off to Melbourne, Australia, making sure that we're managing cases properly, that they're isolated well wherever in health facilities currently, that our staff are well equipped and have enough knowledge to treat these patients as well as prevent the spread. And making sure that our health facilities are ready, that we are ready to take care of these patients first of all, and secondly, of course, to make sure that we don't have spread of this disease within health facilities and to healthcare workers. So all of this, as I mentioned, it's a multi-layered plan. Every single component is essential, and we're making sure that we will fulfill all of the requirements of this plan.
And just the last question for this particular segment. You mentioned that the disease did start off most likely from animal to human transmission. Right now it's only human to human transmission. Do we have any cause for concern for contracting this new 2019 novel coronavirus from our pets?
No. It's a very short answer, but yes. Frankly, no. WHO has also come out about this and said no, there's no risk of you contracting this disease from one of your domestic pets. They're still trying to identify which animal this spread from animal to human from in Wuhan in China. They haven't concluded which animal it is, but right now you cannot get 2019 nCoV from your domestic pets.
Now, I know I said the last question was the last one, but just the very final one. Am I at risk for contracting novel coronavirus if I receive a package that has been shipped over from China?
No, you're not.
Okay. Thank you very much for coming on to the show, Doctor. When we're back, we talk to Mr. Ashwin Raj, and we'll look at the instances of xenophobia, not just in Fiji, but also around the world. Stay with us. Welcome back. Joining us for this segment, we've got Mr. Ashwin Raj of the HRADC Fiji. Thank you for coming on to the show. Now, we've already unpacked what coronavirus is and what you need to do to prepare for it, and also what happens when and if you are infected with it. Let's look at things from a really interesting standpoint. A lot of people are getting caught up in the hype of coronavirus, what it means, and the implications of what they say, what they share, the stereotypes that are being perpetuated. Now, this particular outbreak has caused a rise in xenophobia, not just for Chinese living abroad, but also for Chinese people or people of other Asian descent living in the country. Before we get down to the nitty-gritty things, can you give us your comments on what the week or what the past month has been like for the HRADC concerning this?
Good evening, Geraldine, and good evening, Fiji. Thanks for having me on the show. In the context of the outbreak of the coronavirus, what we've actually seen is a proliferation of xenophobic remarks and jokes. And we've noticed that, in particular, the Asian community has been subjected to a number of denigrating remarks, and the Chinese community specifically. And what it's given rise to is a series of extremely retrogressive introspection into notions of ethnicity, into questions of nationality, people's lifestyle, the food they consume, so on and so forth, because there's a real cartography of racial anxiety that is associated with the outbreak of this virus, and people are now making all kinds of statements and remarks where they are tying the outbreak of the virus to some of the innate practices, cultural, anthropological, or otherwise. And they're saying that this is intrinsic to a particular community. This is who they are. So, for instance, with our Asian brothers and sisters, there's this really, really denigrating introspection into the kind of food they consume. And what we've noticed is this construction of food as either sacred or profane, and peculiar to certain cultures and people and all of that, without any sort of kind of self-reflection that all communities have, you know, certain cultural practices, you know, food consumption habits and so on and so forth, that might be deemed by somebody else as being very peculiar, strange, so on and so forth. So in that context, what we notice is, you know, sort of globally, there's this whole cartography of racial anxiety around the Asian community in particular. And the mask and the wearing of the mask is an insignia of othering, that this is a group of people whose bodily integrity is kind of leaking and now constitutes a threat to nation states, to notions of, you know, security, to personhood, so on and so forth. And what that kind of paranoia has actually done is now descended into, you know, the debasement of the community, the most racist, vile, you know, sort of vitriol directed at the community. And all of a sudden, people have forgotten that these are the people that you associate with on a daily basis. You go to their shops, you go to their restaurants, you relate to them at a personal level, we are married to them and so on and so forth. Suddenly they've become that, you know, community out there, which is only synonymous with a virus.
Now, on that particular note, it's important that we highlight this. You've mentioned that there's lots of jokes, of course, memes, videos, posts, pictures, all of this being circulated, even being created for this purpose. And in particular, there's a TikTok user, which we would actually discourage you from viewing because that would just be perpetuating it. But a TikTok user, Nazmeen1414, she shared a video in which she spews absolutely toxic, abusive, virulent messages about the Chinese community. Like you said, in particular, their eating habits, even at times outright saying that they're directly responsible for all the deaths caused by the coronavirus. Can you please share your sentiments?
Yes, I want to do that because, you see, it breaks a number of stereotypes about who's a racist, who's not, who's the perpetrator, you know, so on and so forth. Because, you know, this woman, obviously from Fiji, perhaps living abroad, but speaking in the vernacular, you know, she assumes this kind of, you know, overzealous attitude and occupies an indomitable moral plateau from which the way she's talking about the Chinese in particular and the kind of food they eat and all of that, it's almost as if she's never been to a Chinese restaurant. She's never enjoyed their chop suey or yum cha and so on and so forth, has never had any engagement with the Asian community. And that kind of sanitizing and building those walls to say, you know, we got to cordon off these people because, you know, it's who they are and what they consume and all of that, which has resulted in this kind of sort of, you know, peculiar situation where, you know, they constitute a huge threat to, you know, the sovereignty of the body and the integrity of nation states and boundaries and all of that. I thought, wow. And, you know, a number of Indo-Fijians were sending that on the social media because we all have facility to the same language, and they probably thought it was funny. Except I broke that and I said, I think she's racist. And people stopped sending it to me, you see. But you had to do it. And then all these other jokes about the virus is not going to stick around for too long because it's made in China, and anything made in China doesn't have that kind of durability. Again, racist. And so, you know, you begin to get exposed to this sort of kind of logic that somehow the other, as much as, you know, people find themselves in a rather precarious position in terms of, you know, the fact that there's something really unknown out there that we don't really know, we do know one thing. We know Chinese, we know who they are, we know what they eat, ergo, they're the root of the problem.
That's interesting to note because in the previous few segments when we spoke to Dr. Sahu Khan, she had said that this particular coronavirus is part of a strain. You've got 7 different ones out there. And in 2012, 2013, you had the Middle Eastern Respiratory Syndrome, which is, of course, another coronavirus. Now, when that happened, we did not see an outrage about those of Islamic background or that ethnicity, you know, being subjected to all of this. And there's a lot more to unpack with this particular line of discussion. But we get to that after the break. Stay with us. this is the final segment for us, and we've only got a couple of things that we can get
Sure.
through. Looking at what we were talking about previously, social media. It's a very powerful tool, and you can use it in any which way that you want to further your message. Of course, in these particular times where we need people to stand together instead of dividing and perpetuating misconceptions and xenophobic comments and bigotry. What would you say to those who are, shall we say, a little gullible to global trends?
You know, Geraldine, one of the things I wanted to say is the kind of, you know, cartography of racial anxiety and really sort of xenophobia that animates the discussion around coronavirus right now is not very peculiar, because we've seen with the outbreak of Ebola, the stereotypes around Africans, the when HIV/AIDS first, you know, hit the global scene, the stereotyping towards and the discrimination towards LGBTI community. So, you know, we know that racism exists in the most insidious manner and works through this, because we live in an era of political correctness. So I'm not going to come out and, if I have a racist proclivity, and come out and say things about you that would, you know, show my card so clearly. I'm going to say things about what you eat and how you look and what you wear and so on and so forth. So in a circumlocuted manner, I'm going to get this thing out about what troubles me about you in terms of why you're different.
So there's a particular term for it, and that is also something that has been trending worldwide. It's called microaggressions. It's not outright racism. It's not outright saying that you are a bad person or you have tendencies that must be looked down upon.
It's a, you know, it's a repressive tolerance. I will exclude you by including you. So, you know, what the social media actually does is amplifies that. Now, one of the things I wanted to talk to you about the local scene is that when we spoke out against that kind of xenophobia, because, you know, FBC ran several stories about, you know, a few Asian individuals that were targeted here in Fiji, you know, with that kind of xenophobic attack. When we spoke out against it and we issued a statement, a number of people started to take to the social media, including a self-anointed human rights lawyer, you know, who said, why is he fighting for the rights of other people? He should be more focused on Fijians. Can I remind everybody that, first of all, we're all human beings, yeah? So to stand up for somebody doesn't mean you're standing up for those people out there. Remember, if the Asian community can be subjected to it, Lord forbid, if something like this, you know, happened in Fiji, and say we were the origins of some kind of outbreak or whatever, would you like to be subjected to all of that? And how would you feel if nobody stood up for you? So that's the first thing. The second thing is, it's not those people out there. This country has over 30,000 Chinese people. If we're cool enough to, you know, get them to construct our roads and our buildings, if we're cool enough to go out and enjoy their food in their restaurants and all of that, if we're cool enough to every now and then flirt and think how exotic they are, respect those people. Stand up for them, because we are all children of God, and we're flowers in the garden of humanity. So that kind of distinction is very problematic. The other thing, of course, is that you know, realize the precarity of humanity. This virus, again, just like the advent of climate change and other things, is teaching us that these artificial borders and boundaries that we create for ourselves are quite porous, because the traffic of humans, right, world over, and the traffic of emotions and all of that. So the virus, to me, is an insignia of these other deep-seated issues, yeah, which the virus just amplifies. So in a fundamental sense, don't think that you're invincible, because, you know, you can't cordon off people for too long. This traffic of movement, this traffic of people and emotions and all of that is only going to amplify the deep-seated prejudices you have. And one of the things that, you know, just like Dr. Zahu Khan was talking about, you know, prevention and washing of hands and all of that, something needs to happen homeopathically about xenophobia as well. You gotta reflect, break the stereotypes, because, you know, the first basis for discrimination is distinction. You got to talk about why the person is distinct from you because of innate practices such as food, so on and so forth. So you got to break those barriers down so that you're able to recognize the inherent humanity that you and I enjoy despite our cultural differences. And can I go back to the constitutional principles about all being Fijian? This whole notion of upholding principles of non-discrimination and belonging, I mean, that's our strength. So don't turn your back on a group of people that have been historically part of us. And just because there's an outbreak of virus, you turn your back and you see them wearing a mask, you run to the other end of the street. Don't do that because it's insulting. And just think very simply, would you like to be treated this way? Suppose you were in that kind of precarious position. And that's the measure of what we are as human beings. Yeah?
To break down barriers, of course, in essence, it's all about solidarity, humanity before all else.
Yeah.
In the lead up to what may or may not happen, of course, we don't have any cases in Fiji at this point in time, and we do hope that this continues until this is all over. But what are your comments to those who might use this particular platform to further their own personal agendas?
Yeah. Geraldine, one of the problems that I have in this country is that everything that we set out to do is imperiled by either you're pro-government or anti-government. Break out of that frame, because there are things that confront us and afflict us that is bigger than that, right? You look at climate change, you look at the advent of different strains of viruses and all of that. You look at our precarity in terms of the global financial sort of situation and so on and so forth, the rise in intolerance and xenophobia and all of that. You gotta rise above parochialism. You cannot, sit in your silos and say, I'm gonna attack this person who spoke out against racism because I've got this implicit anti-government agenda. You see, you're doing a lot of damage. More than ever, we need to rise above parochialism. You should think about the problems being bigger than your petty pigeonholing and try and become voices of reason and address those issues. So my advice to everyone would be that each time you see, for instance, that lady who put that vile, abhorrent stuff about the Chinese community, every time somebody, has the intestinal fortitude or the temerity to put out something like that, you should also have the gumption to put a counter speech, to debunk the stereotype, to question, because the only antidote to hate speech is more speech, free speech, robust speech, fearless speech that actually begins to undo those stereotypes. Become voices of reason, and people who are going out there perpetuating this thing, realize you're also parents, you're somebody's role model, your kids are watching, you sow the seeds of division today, your kids are going to feel absolutely indignant that my parents did it, it was fine, I'm going to carry the baton of hate and continue perpetuating. You're only digging yourself a deeper hole. The world is much bigger, much more complicated than that, so please rise above that and speak out against racism and stand up for people.
Thank you very much for those comments and also for coming on to the show. That's the show for tonight. We'll see you again next week. Naka.